Staff for long-term care facilities all around the state joined the Maine Healthcare Association at the State House today to speak out on current challenges in the state's long-term care system. They say in the last 20 years, the state has seen the closure of more than 50 nursing homes. The group blames that in part on a lack of funding from Maine Care and a workforce shortage of various necessary positions in those facilities. They're asking for the restoration of cost of living adjustments, or COLAs, which allow for an increase in funding based on the growing cost of expenses. They're also calling on lawmakers to oppose a budget line that would make these adjustments optional. They say these changes would make the healthcare workers more likely to want to work in Maine.
COLA is not optional. In order to recruit and retain well-trained caregivers, homes need to have Maine Care rates adjusted regularly. These important changes will help preserve and protect access to long-term care for future generations.
Currently, we have over 200 individuals in Maine hospitals who have been medically cleared for discharge, but they are awaiting placement in nursing homes due to the lack of available beds. We have the buildings, we have the expertise, but we don't have the staffing or funding to operate at full capacity.
The group is also calling on lawmakers to put $10 million into nursing homes. That was in the governor's original biennial budget proposal, but wasn't included in the budget passed by lawmakers in